Good morning, students. Myself, Dr. Atul Sharma. Now we are study lecture 3, Essentials of Sports Injury Prevention and Rehabilitation. Under this, today we are going to study common injuries of upper limb. Before that, we proceed for the common injuries of reason wise. First, we study the common injuries which occurred at the ground and their what they signifies. So, as you all are aware, when we start playing on the ground, lots of people suffers from the abrasions, and abrasions are nothing; they are just disruptions of the our superficial skin, and it occurs almost all persons, not only in the sports ground, at any place. We used to say, "जरा सा छिल गया था." After this injury, lots of dust particles adhere to our skin or the sebum which is oozing out from the abrasions. So, what one has to do when he suffered from the abrasion, he has to wash the affected body part with running tap water, so the dust particles get uh, dislodged from the uh, our skin, and the skin remains dust free, and it helps in the healing of the wound fast. So whenever you see a person or a sportsman who suffers from abrasions, so nothing to worry, it's just a superficial wound which is heavily sand, and you have to do just wash it with the running tap water, and that's all. Then comes the sprain. Sprain is nothing, it's a ligament injury, and ligaments are the structures made up of collagens. They are thick rope like structure, and they lie between two bones and in the joint region. And sprain, you have quite commonly heard of, I suffered from sprain, or in the local language, whenever some joint pain occurs, we used to say a knee sprain, ankle sprain, or shoulder sprain, like that. And we can divide sprain in various grading as per the imageries available, like from the MRI or ultrasound scan. In grade 1, the minimal amount of disruption of the fiber of that ligament occurs. In grade 2, more than 50% or 50% of the fibers of ligament got disrupted, and if there is a complete tear, we say grade 3 or complete tear. In grade 2, we say partial tear, or grade 1, we say partial tear. And these ligaments protect our joint from any unnatural movement. So, sprain are the injuries of ligament, and ligaments are our passive support of that joint. Then comes strain or strain and contusions. They are the same injuries. The only difference is, in contusion, the force is applied from the outside, and in strain, the force comes from our own body. When muscle is unable to bear that excessive stress, some muscle fiber got disrupted and strain occurs. And when some external force applied from outside, and it damages the nearby blood vessels and the muscle fibers, contusion occurs. In normal day-to-day language, we say bruise. Bruise is nothing but it's contusion only. And what are the symptoms of the sprain and strain? In sprain, strain, and contusions, there is lots of pain, as pain, swelling. The sprain is grade 1 or very minimal, or strain is minimal, or the external force is minimal. So the swelling will be as minimal. And if there is a partial tear, initially pain must be there, but it subside very soon, and then later on it again reappears. In the partial tear or grade 2 tear, the all symptoms like pain, swelling, difficulty in movement, or reduce the strength of that particular muscle or that joint. We will discuss in detail in our next lecture about the treatment part of the sprain, strain, and the common injuries. Dislocation or and subluxation. Dislocation and subluxations are nothing. Dislocation is the complete disruption of the joint, and subluxation is partial disruption of the joint. Like shoulder dislocation, the most common is anterior dislocation, and lateral and partial posterior dislocation is quite uncommon. So when dislocation occurs, the external force is applied, and the active and passive structures of the joint got disrupted, and that the joint structure got disrupted. In the shoulder joint, the muscles are the active, and the bony structure, glenoid cavity, and head of humerus, glenoid cavity, head of humerus, and various ligament and ligament capsules makes a passive structures. And when external force is applied, so these the humerus comes out from the glenoid cavity, and if it comes out anteriorly, and the joint got a the joint movement got restricted, so you say the joint got dislocated. And during subluxation, some movement will be there, and there is no complete disruption of the joint surfaces. So there is a small difference in subluxation. Small movement will be there, and there will be no complete disruption of joint, and the joint will not be completely immobilized. Dislocations and subluxations are self-diagnostic. Then comes fractures. Fractures are the discontinuity of the bone. When external force is applied over the shaft or the bony part, and it breaks out into the pieces, then we say it's a fracture of that bone. And the common sign and symptoms of fractures, again, swelling, pain, there will be a crepitations, or when you feel or the affected part, you can feel the discontinuity of the bone surface. So these are the common injuries when you play or you participate in the sports. You commonly sees these injuries. Next come the limb specific injuries like rotator cuff, upper limbs injuries. Common injuries is rotator cuff, tennis elbow, golfer's elbow, wrist sprain. So rotator cuff. Rotator cuff is the injury of your shoulder joint, and it is quite common. Commonly in the sportsmen who lift heavy weights, do throwing activities, and it's a type of a overuse injury. Or and rotator cuff, as I told you in our previous lecture, it is made up of 4 muscles, and its main function of rotator cuff is to retract head of humerus and prevent the uh, major muscles tendon from the impingement. Then comes the tennis elbow. Tennis elbow is the it also known as extensor common extensor tendinitis, and golfer's elbow is common flexus tendinitis. In common extensor tendinitis, the extension movement of our wrist joint got painful and the pain comes near around elbow, just around the elbow. uh, and in the golfer's elbow, painful flexion movement of our wrist joint, and pain occurs on the medial side of the elbow. Both of these injuries occurs when someone very tightly grip his or her racket, or vulgus force is applied. And in wrist sprain, pain again, it's a ligament injury, and because of not properly activating your wrist, and all of a sudden you start doing any kind of movement without proper warm up, so this kind of wrist sprain occurs. And in wrist sprain, the same uh, sign and symptom will be there. Pain might be very minimal swelling, and pain in difficulty in movements. In lower limb, hamstring, quadriceps, and gastrocnemius, muscle strain is quite common. Hamstring is the muscle of our back of our thigh. Quadriceps is the front muscle or thigh muscles, and gastrocnemius is calf muscles. These muscles are very powerful muscles and mostly used in each and every activity. These muscles is generate lots of power, and that's why they are more common for injuries. In hamstring injuries, you might have heard ki your sportsman will come as soon as I start off or I shoot, all of a sudden my muscle got strained, because the sudden burst of power was not uh, held by the muscle fibers of the hamstring, and they got damaged. Sometimes it's minimal tear, it weans off in day or in a week. And when the strain is quite severe, and the few more than few fibers got disrupted, that might be a swelling on the localized tenderness over the hamstring, oblique quadriceps, or gastrocnemius muscles, that is calf muscles. Then comes the lower limb injury, ACL tear, anterior cruciate ligament, posterior cruciate ligament, and meniscal tear. They all three are part of our knee. Menisci are the cushions of knee joint, and the anterior and posterior cruciate ligaments hold the knee joint, um, and they protect the knee from swaying out from their usual positions. When the powerful quadriceps and hamstring muscles got activated, these are the two structures, ACL and PCL. They hold the knee and uh, hold the knee joint, and they are very powerful ligaments. They generally got disrupted. ACL tear is quite common rather than PCL tear, and ACL tear usually occurs when acceleration is sudden acceleration is stopped, or the ACL tear occurs. ACL tear occurs with the twisting movement, uh, and sudden stoppage of ACL tear occur, anterior cruciate ligament injured with the when some athlete is twist his leg or twist his knee, or he is playing and suddenly he turns and the opposite or opponent block his uh, leg, then ACL or ACL injuries occur. After ACL and PCL injury, there is a massive swelling, and it is mostly within half an hour. Swelling will appear. Patient will be in excruciating pain, and limb is he will not able to fold his or he is not able to fold his knee or extend his knee. In meniscal tear, in meniscal tear, uh, swelling will appear after some time, and patient is unable to extend his knee. So treatment or primary management we will study in our next lecture. In ankle sprain, our the lateral or medial ligaments of the ankle got disrupted because of sudden movement of the ankle, and it might be associated with some bony injury or without bony injury. Thank you. In our next lecture, we will uh, study the common causes of these injuries.